Good morning. I want to thank you for the opportunity to speak with you this morning. Fittingly, today is World Heart Day. I'd like to start with a quote from Robert Louis Stevenson. Life is not a matter of holding good cards, but of playing a poor hand well. That is my mantra. I can focus negatively on my poor hand, or I can play it well. I choose to play it well. My poor hand, of course, is class 3 HFpEF and my numerous comorbidities. HeartShare is an exciting project that holds great hope for those of us with HFpEF. As you well know, we are a diverse group for whom one size does not fit all. I think the deep phenotyping this group will be working on holds promise for us. Our diversity lies in our comorbidities. It's safe to say that we all have them, but what I think is important is that they are varied. I wonder if that holds a key to understanding this pernicious syndrome. For example, I have many comorbidities, some of them very serious, but none of them are diabetes, a common fellow traveler of HFpEF. So might it be useful to sort through the comorbidities? Does it matter that I have 3 different kinds of arthritis, idiopathic neuropathy, and stage 4 kidney disease? Does it matter that in spite of having dealt with extreme obesity most of my life, I have not developed diabetes and I did not develop high blood pressure until I was almost 60? Is it only incidental or meaningful that I have glaucoma and AMD? Is blood type a factor? Does it matter if I am A, B, O, or AB? If only 15% of the world's population is Rh negative, what percent of HFpEF patients are Rh negative? Does it matter? Both of my parents had HFrEF. How did I wind up with HFpEF? How is it that I am lucky enough to be alive 8 years post-diagnosis of class 3 HFpEF? What is different about the 20% of us who live this long as opposed to the 80% who unfortunately die within the first 8 years? Does the answer to successful intervention lie in mapping and understanding our diversity? Are the comorbidities coincidental, contributory, or consequential? I understand these may not be the questions you are planning to tackle in your search for phenotypic understanding, but they are the questions about which I think. As a patient, I'm committed to helping with research in any way I can. Of course, I want to live longer and well, but even more important than that is helping find interventions that will improve the lives of others earlier in care and potentially offer cure. So I look to you and this fantastic collaborative undertaking to help those of us with HFpEF to play our poor hands well. And one more thing, I hope you will think of us patients as partners in research. We want to work with you to be sure that trials are developed to which patients will accrue and be retained. Answers to research questions matter, but so does what is important to patients. We are all in this together. Some of us just have a lot more at stake than others. Finally, I want to give special thanks to Dr. Barry Borlaug and his team. When my HFpEF was playing its chameleon game and fooling other physicians, Dr. Borlaug saw through that ploy. He and his team keep me alive and functional, for which I am profoundly grateful. Doctors Borlaug and Redfield have included me as a member of the Mayo HeartShare team. For that, I am also grateful. My gratitude also extends to all of you. Thank you for all you do and will be doing together to improve quality and length of life for HFpEF patients so that we can keep playing our poor hand well. Thank you.
Cynthia, can you hear us?
Yes.
Hi, this is Javed Butler here. I really want to take a moment to thank you. This is not scripted. This is not part of the program, but I just took the opportunity to just stand up and grab hold of the mic. Those were really, really inspiring words. So thank you so much for all you have done. Obviously, we have worked together on several projects and several initiatives before as well. And your constant availability to partner with us is highly appreciated. And I just wanted to take this moment to thank you.
Oh, thank you so much, Javed. Right back at you. I am so grateful that I know you all and that we work together and that you're really working hard to help keep us alive. Thank you.